Good morning, everybody. So my name is Monica. I'm a nurse care coordinator, and I work for the Center for Children with Special Needs at St. Christopher's. And we're a pediatric practice that manages children with special health care needs and their siblings. And our mission basically is to work together with families to make sure that they get ongoing, comprehensive, culturally sensitive care for their child as well as for the family at large. And my role there is pretty unique in that I ask a family when they come into our office, what is your biggest, most pressing concern? How can we help you? What is first on your mind? And a lot of times it's, well, I'm worried about my child's medical condition. I'm worried about what specialists they need to see. But a lot of it is, I'm trying to hold down 2 jobs and I'm a single parent and there's nobody to help me take care of my child. And I have 4 other children at home. And so when I do a needs assessment, I meet with the families and I say, well, let's talk about this, because your insurance may have a contract with different nursing agencies, home health agencies that could help with some of that care. And part of my role is to make sure families understand what the rules are when it comes to medical necessity. We have about 1,800 children with special needs, and of that, maybe 600 to 700 get some form of home care. And we're asking insurance to pay for that home care, but there are rules, and the rules change every day. So part of my job is to make sure I keep up on the rules, and then also, make sure the families understand the criteria. For example, if a child has a feeding tube, or maybe on oxygen or on a monitor, then it is a skilled nurse that child needs for services. If it is a child who's dependent on their adult caregivers for all activities of daily living, such as bathing and dressing and feeding, then that's a home health aide. And through that, I work with families and we try to then get together the information to justify those services. And everybody wins in the long run, which is why this is so great, okay? The parent can go to work, and then that can afford them a more comfortable way to live. And also, the child gets the care that they need. And we just make sure we follow the rules and we provide right information, like a work schedule as mom is working. That goes to the insurance company. A school schedule if mom is going back to school. I should say parent is going back to school. That also justifies some of those services. So that's part of what I do. Some of the other things I do is I'm a liaison. So for example, if a family is struggling with getting certain pieces of medical equipment from a company or getting it authorized, I assist in arranging those services. I also work with some community agencies, so I find out what the abilities of the child are, what resources the family has for the child, and then provide additional referrals. We like to develop a medical summary for our children, and a medical summary is basically the child's demographic information and insurance. It's a list of their medical problems. It's a list of their medications with known allergies. It's a list of the physicians and their contact information to make sure that if in fact a child with a respiratory problem goes to the emergency room, they know which doctor to call. It's a little bit of their history so that they understand what happened 5 years ago when the child was born, so that today when they come to the ER, the doctor can then focus on what the acute problem is right now. It's also an emergency plan. So if, for example, the child is oxygen dependent and his oxygen saturations are going a little bit low, then part of the emergency plan is, okay, now you have to bump it up, and this is the doctor that you have to call, and if it gets worse, then you have to call 911. And what's nice about this care plan is that it also has the community resources involved in the child's life. So if early intervention is involved, that information is on there. If the school district is involved with an IEP, that information is on there. Any resource, if home nursing or if equipment's involved, that information's on there too. And this care plan, we actually at our office utilize it when the child's going to a new specialist. The family will say to me, can you send it off to this specialist so that they understand what the history was, so that, my child's 14, I can't remember that he had 8 surgeries and it was in 1999, 2001, 2008. This way it's all in print so that the doctors can review that. It's also utilized in IEPs. As a matter of fact, I've attended IEPs with families, and it's utilized because sometimes the schools do not understand the other health-related services that are necessary for the proper placement for the child in the specific school with the specific classroom and the specific curriculum. So I'm happy to sit and attend that IEP with the family, and sometimes I don't have to say anything at all. I'm just at the table, and all of a sudden, let me bring the school nurse in because I see there's someone from the doctor's office who's concerned enough to come here so that we can then address some of the needs. Right now, in the Philadelphia School District, I can only speak for them, there have been significant funding cuts. And in many of the schools, there is not a full-time nurse. And so if the child is going to school and needs those services, it needs to be in the IEP under other health-related services. If the school cannot meet those needs, I asked the school district to write me a letter stating, yes, this is in the IEP under other health-related services, but we can't meet the child's needs from a medical perspective. Then I'm turning around and writing a letter of medical necessity and asking insurance to cover it. And for the most part, insurance has been covering it with that documentation and with the IEP. So that's another way we can make sure the child is safe in school and that the child gets what they need. There's a lot of considerations, and I don't have to tell you guys this because you live it day in and day out, when you're providing the care for your medically fragile child. We look at can the house itself handle the medical equipment if the child's on a lot of medical equipment? Is the electricity safe? And is there barriers when it comes to, I have a child who has, for example, cerebral palsy, who is not ambulatory, but his bedroom's 14 steps up. And now he's 12 years old and he weighs 90 pounds. And FYI, we care for children, a lot of them in North Philadelphia, so they're in Section 8 housing, they're not owning the house, and what is the capability of being able to get that child from the first level to the second level where his bedroom is, and also, God forbid, if there's a fire, how do you get that child out of the house? So we work with families and we talk about things like first floor setups to maintain the safety of the child. And if in fact it's allowed for stair glides or ramps, then we start to look at some funding sources so those things can happen as well. If you do have home nursing or home health aid services in your home, privacy goes right out the window, right, for those of you who've had that experience. So, you may have a child who has needs, who has medical equipment, and then the technician's coming in and out of your house checking the medical equipment. And then you've got 6 different nurses, 6 different times coming in. Oops, they're 2 hours late. Oops, they have to leave early. Oops, that one called out sick. We got a brand new nurse, and the parent's the expert in the child's care. So it's the parent that's actually orienting the nurses, right? You can't even have an argument with your significant other, or you can't scold your other child because you're worried about, oh my goodness, what's our nurse going to think? Or oh my goodness, if I'm scolding my child, are they going to report me? So privacy kind of goes right out the window. It's a double-edged sword, right? You need the services for the child, and you may be working or you may be in school, but at the same time, some privacy tends to go away as well. When is there time to attend everyday needs? I have families that come into our office and they're like, Monica, I can't even go food shopping. I have my son, he has autism, and I cannot take him to the grocery store because he gets away from me. He tries to run out into the street. And we explore those things and we see what other services can be put into place so that maybe it's a little easier to do those day-to-day things that absolutely everybody has to do. Siblings need attention too. I mean, a lot of times, the parent with our child with special needs comes into the office and then you have 2 siblings. I've had siblings come at me trying to do, a tackle, and, they really, really do vie for that attention, and we're giving books to people. I got Dr. McNesby rolling up paper and they're playing basketball. He's got the trash can and, they're throwing the baskets, and we try to show the families, and, the families do provide the attention for all the kids, but it's just really hard because, you have such challenges with these kids with special needs that the siblings sometimes feel like they need a little more attention too. We always see an increase in our single-parent families, and that becomes a struggle. We talk to families about having a backup plan. We had a situation recently where we had a young man who has Duchenne's muscular dystrophy, who cannot move on his own, who is dependent on a respirator, and his mother took ill and was 911 to the hospital. and I worked with the waiver people and got 24-hour nursing in there. But 24-hour nursing isn't guaranteed. A nurse can call out sick. She had no backup caregiver. She was going to be in the hospital and actually ended up needing rehab. And the nursing wasn't guaranteed, and so we spoke with him, and basically he decided for his safety he needed to be placed in a facility, which can be a temporary placement until then mom gets better. But I always talk to families about, if you are a single parent, think about who can be your backup. Is it your significant other? Is it your adult son or daughter? Is it a friend, an aunt, a cousin? Because life is very uncertain, and it's very good to have backup when is needed, okay? Some of the other things that we talk about when we meet with our families is, it can be very isolating, I would imagine, to have a child with special needs, and you're really focused on your family and your need and their needs, and there's not enough time to really socialize. Let's go out to dinner, let's meet other families. We work with parent to parent. We have a parent that comes into our office, Kali, she's wonderful, and she links with families, and then she tries to help them network with some other families as well, which actually is a wonderful thing. And I think families learn from other families. I learn from our families every day. They educate me on a regular basis. Obviously, especially with the economic times today, there's a lot of financial stress. There's laws that are changing all the time about funding cuts. A couple of times, at the Harrisburg level, they were going to take away the diaper program, or they were going to start to charge co-pays. And we're signing petitions, and we're making our voice known to make sure that our families and our kids are protected. And so far that hasn't happened, and that's a great thing. But I know it's always a worry in everybody's mind because the funding cuts are real. I know that I am experiencing more denials and helping families go through the appeals process. Insurance thinks if they deny, people will walk away, but not us. We don't walk away. No. We will help you through the appeals process to make sure that insurance does understand that this is why this is justifiable, this is why it's necessary. So I am experiencing some of that, and again, I think it relates to the funding cuts that are happening. There's the stress of the diagnosis of the child, and then there's always these little setbacks, like you're doing well, you've gotten over, the hill and gotten to the point where things are going well, and boom, child gets sick, they end up in the hospital, boom, there's some problems with school, and maybe the school's not going as good as it should. So again, that's hard, and that becomes stressful in folks' lives as well. Quickly, some of the supports that are local and national are things like Social Security disability, which I'm sure you're all aware of. In Pennsylvania, there's the PH 95 law, which says even if you're a working parent and you've got primary private insurance for your child with special needs, that your child meets for a secondary Medicaid, which covers things like co-pays. So if your child's going to 3 or 4 specialists and the copay is $25 to $30 and you have a secondary Medicaid, that secondary Medicaid will pick up the copays. That secondary Medicaid a lot of times will pick up the home nursing and the home health aid services. There are county-based programs such as early intervention. There's parent support groups like United Cerebral Palsy and Parent to Parent. And then I just would want to say in closing, and then I'm going to turn it over to Dr. McNesby, we have a growing population of children with special needs, and they're becoming young adults. And our new challenge, and this is what we're addressing in our office right now, is figuring out how we can get the great services to transition these children to the adult world. Find adult providers that absolutely will embrace these young people. Find the waiver services that are necessary to make sure that these children and young adults are cared for in an appropriate fashion, and try to plug them into things like adult day programming. So thank you for your attention. I'd like to turn everything over to Dr. Francis McNesby, who I've had the privilege of working with for the past 10 years. And he is a physician who is dedicated to children and families with special health care needs. So I'd like to turn it over to him. Thank you very much.